Morning, Dr. Lipo Gyno, so serving up a fresh case of Gynecomastia. So this is a revision case where he already had gland removal done in the past and a little bit of lipo, and there were big glands. So today what we're going to do is we're going to do the belly, the abdomen, the chest. No lipo up here. We're going to definitely put some lipofilling here to fill this up over here because the glands were huge on that. Maybe do a little nipple areola lift, but you know, in dark skin, you got to be careful about a nipple areola lift. We're going to talk about that. It's done under local, so he's going to know everything. He's not going to wake up and say, "Okay, doc, what did you do? What did you not do?" He's going to know everything. So we're going to do that. Stealth incision, armpit, nipple, belly button, groin. He's got some loose skin, but again, he doesn't want a tummy tuck at all because of the scar potential. But if we need to do it, you know, maybe we'll do it some other time. But let's see if we can hit it with the Vaser and the Renuvion and all that stuff. Get the midline, get the semilunaris, get the V to P, go all the way around, and we're gonna do all of this junk, and maybe probably put some fat in his booty. He wants a little junk in the trunk. You know, a little milkshake there, and definitely do some lipofilling, especially over here to give him that hockey stick look and get this here. Do the 6-pack, 2, 4, and 6. Stealth incision, a stealth incision in the groin as well as the other places, and one just above the butt creek. What am I saying? Crack. And maybe I'll do one over here to get around to what I call the point of maximum indentation. All under local anesthesia. Let's make him look fabulous and hop to it.
Out of here.
Sucking the belly. Good. All right, so we're going to frame him. All of this. Don't have to go much to the fupa. He doesn't have much of a fupa there. Go up here, get the semilunaris. Yeah. We're going to get this box here, really hit that box hard.
Hit it hard.
Yeah. No fat grafting, and no lipo here. We have to keep that fat nice. Definitely put some fat grafting there. The lats going all the way back over here. Lats going all the way back to here. Good. Good. You can already see the serratus muscles. We already did that, so let's see here. Boom. Boom. This is what the 6-pack looks to me. Boom. Boom. And really just keep them. I'm going to not do any lipo on that. Keep it, but do the Renuvion. He's got these stretch marks that, you know, I would love to do a tummy tuck on him, but I don't do tummy tucks, and he wants me to take care of him. So we'll figure that out. If I do one, we can maybe do a mini tummy tuck, you know, later on in life. So here we go here we go here. What's the matter? You have a cold?
Allergies.
Allergies. Good. Good. Now come on over here, all the way back here, baby. Now, here we go. Oops. Okay, tighten up your butt muscle. Good. Let's see. Yeah.
Yeah, you see that flatness back there?
Yeah, I got
Yeah.
it.
I got a long back and then cheeks to follow.
Back with a creek.
Yeah, back with a creek.
Tighten it up. Tighten up your butt. You don't have much of an indent. Little. Yeah, we'll fill that in nicely.
See? Thank you. I don't have any booty.
All right.
Welcome to the club.
Okay. What's up, buddy?
I'll go top of my back. I think it's nice.
What's that?
The top of my
Yeah, the top.
back. That kind of looks nice.
Well, you got one thing going for you, huh?
Yeah, I know.
Got one thing. All right. That's good. You have to put a lot of stuff in there. Low down here. Fill that up nicely.
To pop, you are.
Alright guys, so here we are, we finished the vasering. Now we're doing the lipo. I'm using my long instrument because I gotta get all the way down to the bottom. So it's a 4mm Mercedes. I bend it a little bit just to make sure that I can get around the corners and get really good definition to his abdomen, his flanks, his back. Alright, so working really hard over here. You gotta really hit this bottom part really hard. I already did the horizontal, parallel. Now I'm going to hit it at a right angle. I can feel myself really getting this. This is what I want to do for this guy. Good. So you can see that right there. Now, going really good. Same thing with the serratus muscles. I did parallel. Now I want to do it. I want to hit this at a right angle. And the same thing. Alright guys, so here we are on side 2. Very tough case. Very tough case. He had surgery before, a lot of fibrosis, a lot of scar tissue. He had big glands, and we have to do a great job. Alright, so here, really tough case. It's a redo, and now I'm etching the top of the 6-pack and the bottom of the pecs to really get in there and cause some great lights and shadows. Alright, so here I'm digging into top of the 6-pack, doing it with my karate chop technique. Going there and grabbing this So here we are. This is a redo, so it's very tough. But the bottom is where we really want to get most of this tightening. So guys, so we're doing Renuvion here. We did it here already about a year ago. Less than a year ago. About a year ago. Less than a year ago. So it's just a little touch up here, but the main event is the lower part. And since he was coming back for the lower part, I said, let's touch up the top and let's put a little fat grafting into his pectoralis major muscle because he had a big gland and needed drain, so we couldn't put fat grafting in when we did the initial time.
0.5 for 1.
Got it. All right, guys, so I'm in the front on the left side, finishing up with Renuvion, especially down below. He needs all the skin tightened. He does not want a tummy tuck for a couple of reasons. Doesn't want a scar there. With the skin color, the scars, are not the prettiest. And in men, tummy tucks, unless you really need it, doesn't look good. With this, I think he'll get like an 80% improvement. If he wants an extra 10%, I think maybe, and I'll be more than happy to do it, I'll do like a mini tummy tuck. Mini tummy tuck is we leave the belly button alone.
0.5 for 1.
The belly button is besides the scar, is the telltale sign that a person had a tummy tuck. Because the belly button looks a little
Weird.
off. A little off. He had previous gynecomastia surgery with big glands. So now what we have to do is we definitely have to do some pectoral lipofilling in there. So we're gonna get this purified fat, get in the muscle. I've already numbed them. There we go. You all right? Perfect. And let's do amazing work here. You okay? Good. All right, Dr. Lipo, finishing up, this is the front view of this 28-year-old gentleman from Atlanta, Georgia, who we did revisional surgery. We did Vaser high definition, power-assisted liposculpture. Glands were removed at a prior operation. We did the entire chest and abdomen, as I call neck to nut. So we did pectoral lipofilling. We put 200 cc's of each in each pectoralis major muscle. Stealth incision in the armpit, by the nipple, in the belly button, and in the groin. We did the midline linea alba, the semilunaris going to the V to P. We did Renuvion JPLASMA, especially on the lower abdomen, to tighten that up as he did not want a tummy tuck. We did the serratus muscles. We did the six-pack 2, 4, and 6. He will have an amazing, amazing outcome. We posted the back that we did also with gluteal lipofilling. So this is the results that you expect, you deserve, and you want. And this is what I give you. Dr. Lipo, Lipo Gyno, 631-424-0101, or email me at jonathanlebowitzmd@gmail.com. Thanks and see you soon.